Suctioning. There are two different types. We have endotracheal, which is closed, and we have nasotracheal, which is open.
Suctioning is the application of negative pressure to airways through a collecting tube. Suctioning of the trachea and bronchi is usually done through the endotracheal tube or the tracheostomy tube.
Open is a sterile technique, requires disconnecting from the ventilator. Whereas closed uses the sterile closed inline suction catheter, which is attached to the vent circuit. The catheter can be advanced into patient's ET tube airway without the patient being disconnected from the vent.
In this video, we are going to be talking to you about the indications, contraindications, the equipment needed, a step-by-step how the procedure goes, what needs to be monitored, and some extra tidbits of information.
The indications for open and closed suctioning are as follows. The need to maintain patency and integrity of the artificial airway. The need to remove accumulated pulmonary secretions as evidence of one of the following. Sawtooth pattern on the flow volume loop of the monitor screen of the ventilator or the presence of coarse crackles over the trachea. Both are strong indicators of retained pulmonary secretions. Increased peak inspiratory pressure on the volume control ventilation or decreased tidal volume on the pressure control ventilation. Deterioration of O2 saturation or blood gas values. Visible secretions in the airway. Inability of patient to generate an effective cough. Acute respiratory distress. Suspected aspiration of gastric or upper airway secretions. And also the need to obtain a sputum specimen to rule out or identify pneumonia or other pulmonary infections for the sputum cytology. Indications for closed suctioning are as follows. Mechanically ventilated patients, especially neonates and patients with a PEEP greater than or less than 10 centimeters of H2O, mean airway pressure greater than or equal to 20 centimeters of H2O, inspiratory time greater than or equal to 1.5 seconds, an FiO2 greater than or equal to 0.60, frequent suctioning greater than or equal to 6 times daily, hemodynamic instability associated with vent disconnection, respiratory infections requiring airborne or droplet precautions, and inhaled agents that cannot be interrupted by vent disconnecting. Examples are nitric oxide and helium O2 mixture. The contraindications are as follows. Endotracheal suctioning is a necessary procedure for the patient with artificial airways. Most contraindications are relative to the patient's risk of developing adverse reactions or worsening clinical condition as a result of this procedure. When indicated, there is no absolute contraindication to endotracheal suctioning because the decision to withhold suction to avoid possible reaction may be lethal.
Hazards and complications for endotracheal suctioning. Hypoxia, hypoxemia, tissue trauma to the tracheal and bronchial mucosa, cardiac arrest, respiratory arrest, cardiac arrhythmias, pulmonary atelectasis, bronchoconstriction, bronchospasm, infection, pulmonary bleeding, intracranial pressures, interruption of mechanical vent, hypertension, and hypotension. Hazards and complications for nasotracheal suctioning. Hypoxia, hypoxemia, cardiac arrhythmias, arrest, bradycardia, increased BP, hypotension, respiratory arrest, uncontrolled coughing, gagging or vomiting, laryngospasm, bronchoconstriction, bronchospasm, discomfort, pain, nosocomial infection, atelectasis, misdirection of catheter, increased intracranial pressure, pneumothorax.
Hi, the supplies that you're going to need for nasotracheal suctioning and endotracheal suctioning are as follows. We have our oxygen with our flow meter and a non-rebreather for emergencies. We have our suction canister with our suction tubing and our suction adjuster here. We have our masks. We have clean gloves for closed suctioning and sterile gloves for open suctioning and for nasotracheal. We have our inline catheter suction here. We have our nasotracheal catheter with our lubrication, sterile water, an ambu bag for emergencies, a yanker for open suctioning, a sputum collection container, a pulse ox, and a stethoscope.
And the options on the suction pressures for open adult -100 to -120, children -80 to -100, infants -60 to -80. For closed suctioning, adult -120 to -150, children -100 to 120, infants -80 to -120.
To start, we're going to put our disposable gloves on, our clean gloves. We're going to assess our patient. We're going to make sure that we have everything that we need. We have our inline suctioning with our tube to our suction canister. We have our vent here on standby with our oxygen as well. Now to start our closed suctioning, always hold your endotracheal tube. We're going to hold on to our tubing, and this has to be done in 15 seconds or less. You're going to put your tube down through until you meet resistance, and then you're going to squeeze and pull. You're going to give them about 30 seconds here. And then we're going to do it again. Again until we meet resistance. Squeeze and pull. We're going to hyperoxygenate again. And we're going to assess them again and see if we got any of that out.
Rule of thumb. Your ET tube is measured in millimeters. Your suction catheter is measured in French. So to quickly get the size needed for your specific ET tube, you can either take your ET tube inner diameter size, divide by 2, and then multiply by 3 and get your size. Or take your inner diameter times by 2 and get the number and use the next smallest tube.
Now I'm going to show you nasotracheal suctioning and open suctioning. This is a sterile procedure. You want your patient in the sitting upright position with the sniffing position. First you're going to put your gloves on. In the nasopharyngeal airway, you have to measure this. You want to go from the nose to the ear. You can open your nasotracheal suctioning, but do not touch it. It has to be sterile. We're going to insert. We do this, we use the nasopharyngeal airway for patients who can be conscious. You do not have to be unconscious to use this procedure. And we use it to help protect the nasal mucosa. These are your sterile gloves. Once you open this and touch, you cannot use your hand. They are sterile. Now that your hands are sterile, you want to use your left dominant hands. And to use your lubrication. And to get a sputum specimen, you're going to hook. Now since this hand touched this hand is now dirty. You keep that hand away from your patient. I'm going to insert. And you give them a couple minutes. This will provoke a cough, and that's what we want. And then you will do it again. And that is how you close suction, open suction.
The following should be monitored before, during, and after procedure: breath sounds, O2 saturation, skin color, pulse oximeter, respiratory rate and pattern, hemodynamic parameters, pulse rate, blood pressure, electrocardiogram, sputum characteristics, cough characteristics, intracranial pressure, vent parameters, peak inspiratory pressure and plateau pressure, tidal volume, pressure, flow, volume, graphics, and FiO2.